Speaking of reopening, as Nevada continues to reopen, what does that mean for medical and health care? I spoke with a doctor from Southwest Medical to talk about their new normal, and here's our conversation. Dr. Cart, thank you so much for joining us.
Of course. Thank you for having me.
What can you tell us about what's changing for you as Southwest Medical?
Well, so initially when the lockdown was put in place, we would screen our patients and see, those with comorbidities such as like hypertension, diabetes, our elderly patients, especially in this clinic, we do have a larger geriatric population. So we'd screen them over the phone to see whether they necessarily needed to come into our clinic and be seen, or if this was something that we could resolve or take care of over the phone for them. And then pretty quickly we moved into our telehealth or our video appointments. And now we're kind of transitioning to increasing our face-to-face appointment versus seeing them on the video.
Okay, and what about for mask and hand washing and social distancing? Some people are kind of scaling back on the seriousness of it and others are still enforcing it. So how do you feel about that?
Well, I think as things open up, it is easy to let our guard down, but we do have to be careful and mindful that the virus is still there, and still, nobody is immune to it, so to speak. So it's still really important to maintain social distancing of at least 6 feet whenever and every time that we can. Hand washing is, of course, really important. Washing your hands for at least 20 seconds with soap and water. I'll tell you, for us here at Southwest Medical, our patients that do come to see us here, they get screened at the door, their temperature is taken, and they are provided with a mask if they don't already have one. And all of us here throughout our whole day, we wear masks. I'm just not wearing one right now.
Of course, for purposes of the interview, right?
For purposes of this, yes.
What if someone has an appointment, a medical appointment? Should they keep it or should they cancel it?
So now that we've kind of moved into our phase 1, where we've increased our more face-to-face appointments, we would like our patients to come in. The screenings that we have in place is just for the safety, not only of our team members here, but also for our patients. So if somebody does show any symptoms, they don't get to come and sit in the waiting room with the rest of the patients that are feeling fine. So we do encourage patients to come in and be seen now.
What's the problem with delaying vaccinations for your child or baby until the pandemic is actually over?
People should not delay their vaccinations, which has happened because of the pandemic. It's still important because the other diseases that the vaccinations are available for, those can still occur. So it's still important to, follow up with the pediatrician and get the recommended vaccinations.
You can also join me live today with Southwest Medical at 4:30 on the 8 News Now Facebook page. So get your questions ready.